So a topic that I wanted to touch on was individuals with chronic back pain or non-specific low back pain. So they don't have a direct mechanism of injury that brought it on. It's relatively insidious in onset. They don't have any red flags. They don't have any radicular patterning or sensation or motor deficits. They just have kind of that generalized achiness in the low back, and they've been referred to you for PT, or maybe they're direct access and they finally said, I need to address this. It's been going on for too long. I finally need to take a formal approach to this. And one thing that I found myself struggling with early in my career was trying to make the perfect program for these individuals. And I would also be at a point in my career where I was going through different continuing education courses, putting different tools in my toolbox, doing dry needling, learning SFMA, I did PRI courses, I did DNS, I did all these different systems and models and ways to intervene on people. And when I look back, as I went through these different phases of my career where I'd be biased a little bit more towards one treatment methodology or another, I've come to the realization that a large number of my patients got better regardless of what specific intervention I was doing with them. And I think the big take-home message for that was commonalities with this patient population was that a lot of them were coming in as a relatively blank slate, meaning that they hadn't done anything to formally address their condition prior to coming in. They weren't aware of just some low-hanging fruit in regards to daily movement and just being physically active on a daily basis, meaning getting up and going outside, going for walks, finding structured times just to monitor how many steps they're taking or what types of activities they're doing through their day. They weren't very mindful of the types of activities that were provoking their back pain or alleviating their back pain. They weren't having consistent sleep patterns. They weren't having consistent diet patterns. And in general, they weren't doing anything to address their low back pain from a mobility, stretching, or strengthening standpoint. So what I'm trying to come down to the big picture with this is there were so many areas for opportunity for these individuals that you really could have picked any one of them as a starting point and probably had success with them. Now, there's definitely going to be certain factors that are more influential than others. You're going to have some that may have a very good strength background, but they lack some significant mobility impairments. You may have some people that are very mobile, but they lack some prerequisite strength or core stability. Some people may have jobs or tasks or daily activities that require certain movement patterns and positions that put stress in areas more than what the average individual does. So having a good understanding of what the different influential factors are, where on the spectrum they may be biased to needing more mobility work, needing more strength work, maybe they're not doing anything and they're a relatively sedentary individual and they just need to get up and move. And there's a lot of good literature out there that the specificity of the exercise that we choose is not as important as just being consistent with exercise in general for this population. So I think one thing to keep in mind when you have the chronic pain population or you have the non-specific low back pain population, find an easy entry point that has not been addressed by the individual yet. Give them parameters as to how to be consistent with it and find ways for them to get daily consistency and compliance to it. And then from there, you can start adding layers and pieces to the puzzle. But start easy, be consistent. Keep in mind that whatever you are giving them to do is already more than what they were doing the day before. So we don't need an A+ for a program. We need something that's acceptable, and then we can optimize it as we go.